Let's discuss the Chinese and Western medical thought, the disease causation in Western medicine. The etiological standpoint attributable to Henley and Koch was based on what the Henley termed necessary and universal causes, by which he meant that a cause must always have the same effect. The cause must also be necessary for its effect. Applied to the tubercle bacillus discovered by Koch, this implied that anyone suffering from tuberculosis would have the tubercle bacillus in his body, and anyone with the bacillus in his system would suffer from tuberculosis. That is, the tubercle bacillus was necessary and sufficient for the contracting tuberculosis. Henley seemed to want to use this to characterize disease causation in general, but there was an unsatisfactory narrowness in his notion of causality. This was evident when he characterized doctors in the following passage. Only in medicine are there causes that have hundreds of consequences, or that can, on arbitrary occasions, remain entirely without effect. Only in medicine can the same effect flow from the most varied possible sources. For almost every disease, after a specific cause or the admission of such a cause is not yet known, one finds the same horde of harmful influences: poor housing and clothing, liquor and sex, hunger and anxiety. This is just as scientific work as if a physicist were to teach the body's fall because boards or beams are removed. Henley approved of the approach of the physicists who sought a single common cause, gravitation, to explain its instance of a class of similar events, the falling bodies, and felt that rational medicine should do the same. He criticized medical researchers of his time for attributing causation to events that immediately preceded the event instead of following the physicists and seeking universal scientific principles like gravitation. One could argue that Henley Koch's etiological standpoint often commits similar sin. For example, the bacillus that causes tuberculosis has an immediately preceding status, similar to that the removal of a board preceding the fall of a body. That is more pertinent in Henley's example of falling bodies to identify the motivation for identifying the cause of the fall. Depending on the motivation, the questions of who removed the board and for what purpose would be natural ones to ask. Indeed, if the falling body was that of a human being working on a construction site and that courts were trying to case of a homicide after someone removed the board on which the victim stood, no prosecutor on court would charge Newtonian gravitation with the crime. If an act of sabotage was involved in the removal of the board, the cause of the fall for the purposes of ascribing reprehensibility and meting out punishment would be the willful removal of the board by the saboteur. Henley's inept choice of example for the disease causation is a symptomatic of the fact that the literatures of medicine and philosophy of science rarely intersect, even though the accounts of causation in the philosophy of science potentially could help elucidate the nature of disease causation. Consequently, the notion of disease causation is a subject with which modern epidemiologists have expressed difficulty. Stevens, for example, laments that the crux of the issue is the use and the meaning of cause in medicine. If epidemiology continues to disregard the misusage of terminology, it threatens the very survival of logic and science in medicine. Harder declares that it is totally pointless, hopeless, and downright silly to think one can ever state precisely what it is for one thing to cause another. As a matter of fact, the philosophical problem posed by Coach Henry Carter and others arises from focusing on necessary causes and not paying enough attention to sufficient causes. A necessary cause is often better viewed as the definition of disease rather than its cause. For example, the presence of tubercle bacillus in the body merely defines tuberculosis as a disease. A person in whom the tubercle bacillus has taken hold suffers from tuberculosis, but this says nothing about how the bacillus came to take hold in the patient's body. That is, the factors that combine and are sufficient along with the exposure to the bacillus to bring about his disease. Thank you for your attention.